Welcome back to Patch. I'm Chris,
I'm Sawyer.
and today we're going to be talking about adolescent drug abuse. The abuse of alcohol and illicit and prescription drug continues to be a major health problem internationally. The United Nations Office on Drugs and Crime reports that approximately 5% of the world's population used illicit drugs in 2010, and 27 million people, or 0.6% of the world's adult population, can be classified as problem drug users. It is estimated that alcohol abuse results in 2.5 million deaths per year, and that heroin, cocaine, and other drugs are responsible for zero point 0.1 to 0.2 million deaths per year. Existing studies have found a high correlation between adolescent abuse and becoming a problematic drug user in adulthood. Therefore, it can be inferred that many problem drug users start abusing drugs at an early age. Additionally, accidental and intentional fatalities that are associated with drug and alcohol use represent one of the leading preventable causes of death for 15 to 24-year-olds population. Alcohol and other drug use in the adolescent populations carries a high risk for school underachievement, delinquency, teenage pregnancy, and depression. Preventative science postulates that negative health outcomes, and including adolescence, requires awareness of characteristics that place youth at risk, targeting risk factors that are modifiable. Many studies have attempted identifying risk factors associated with adolescents' drug and alcohol usage. They discovered a specific risk factor occurring at the societal and community level. At the individual level of society risk factors, the following were identified: laws and norms favorable toward behavior, including lower minimum drinking ages and availability. Being aware of these risk factors can assist families, health professionals, schools, or other community workers with identifying the risk youth and aid in reducing or eliminating risk factors through prevention and treatment programs. The 2010 NIDA reports emphasize both the roles of family and community prevention programs as vital deterring child and adolescent substance abuse. Their findings are summarized below.
Family prevention programs. The NIDA report emphasizes strengthening protective factors to the family, including increasing family bonding and using appropriate discipline. The following family characteristics place children at a higher risk for substance abuse: parent with a history of alcoholism and drug abuse, high levels of family conflict, lack of and or inconsistent parent discipline. It follows that eliminating these risk factors can reduce the risk of a child, adolescent abusing drugs and alcohol. Once these risk factors are identified, families may benefit from formal prevention programs that can focus on enhancing family bonding, parenting skills including communication, role setting, appropriate disciplinary actions, and changing parental behaviors that may place a child at risk for later abuse. One of the many examples of school prevention programs cited in the NIDA report is Reconnecting Youth, a school-based prevention program for high school students with poor school achievement and a potential for not completing their education. Participants may also show signs of multiple problem behaviors such as substance abuse, depression, aggression, or suicidal behaviors. Students are screened for eligibility and then invited to participate in the program. The program goals are to increase school performance, reduce drug use, and learn skills to manage mood and emotions. RY blends small group work to foster positive peer bonding with social skills in training in a daily, semester-long class. Early experiments have shown that participation in RY improves school performance by 20%, decreased school dropout, reduced hard drug use, and decreased drug use control problems such as progression to heavier drug use. In conclusion, drug use and awareness is important to know and be aware of in case you or someone you love experiences it. More and more people are becoming drug addicts, and the only way we can stop this trend is by educating people on why there are better things to do than drugs. Thank you. That is all I have for today.